PH requires a risk evaluation mitigation strategy, which is the REMS program, to dispense a particular medication, ambrisentan. This requires us as clinicians to reach out to them on a monthly basis to do counseling calls. Typically, other drugs would be reached out through a liaison, but because this requires specific counseling through a clinical pharmacist or a registered nurse, it does require these monthly counseling calls to counsel them related to specifically fetal toxicity. So when they're on this particular medication, they do require to have pregnancy tests monthly for any of our female reproductive potential patients. And unfortunately, with PAH, that is a lot of our patients are quite young. So these patients do require, we see a lot of that kind of demographic. So we reach out to them. We're very integrated with the healthcare system. So we work really closely with the liaisons and the physicians and the clinical pharmacists within our team. So it's a really nice integrated system because we have access to the electronic medical record. So we are able to get all that information, history, patient, medication, all of that from the medical record. And then if we did have any questions, we can always go refer back to a clinical pharmacist, the provider, and the liaison to kind of coordinate the care for the patient.
This is a program that is required by the FDA for certain medications that have a pretty significant safety risk associated with them. So the drug manufacturer, upon launching this product to the market, is required to implement the REMS program. And in the case of ambrisentan, which is one of the medications that we are particularly focused on with our PAH program, we do have to follow a REMS program with elements to assure safe use, to ensure that the benefits of the medication will outweigh any of the risks associated with the medication. And in this case, that risk would be embryo fetal toxicity for any female of reproductive potential.